Kisumu County Health Department joined the rest of the world in celebrating and commemorating the World Pre-Eclampsia Day, a high blood pressure condition faced during pregnancy in women. Every year on May the 22nd, it is celebrated to reflect the efforts made to reduce the effects of preeclampsia disease in pregnant women. Preeclampsia disease, which has been pointed out to be a dangerous disease in pregnant women, holds 5% of the death condition as far as health in pregnant women is concerned. The function that brought on board different stakeholders and different organizations that work towards better health of the communities convened at Jaramogi Oginga Odinga Teaching and Referral Hospital, Kisumu, with the theme Predict, Prevent and Prevail. Dr. Lea Okiri, who is a consultant on preeclampsia conditions, said preeclampsia should be diagnosed as early as possible to prevent its effects on teenagers and pregnant women above the age of 35. She urged the government to give weight to preeclampsia disease, just like other diseases, since over the last 1 year they have taken care of 500 patients with preeclampsia disease. Out of 15 maternal deaths in Kisumu County, 8 were as a result of preeclampsia. She added that there is a need to sensitize the community on preeclampsia disease for the women to be aware of the preeclampsia disease for early diagnosis, as it is one of the causes of prenatal deaths. On the same note, the survivors also took that time to narrate their journey through the preeclampsia disease and urged other pregnant women and teenagers to go for early screening for diagnosis to prevent the rampant deaths and stigma.
My name is Lea Okiri. I'm a consultant, obstetrician, gynecologist, working at Jaramogi Oginga Odinga Teaching and Referral Hospital. Today we mark the World Pre-Eclampsia Day, and the theme for today is Predict, Prevent and Prevail. This is a call to predict the mothers, the pregnant women who we see in the community, who we see in our health facilities, to predict, to bring them out, to look at them well, and to judiciously review them, taking time to look at them to see how they are doing. What is preeclampsia? It is elevated blood pressure when one is pregnant beyond about 20 weeks. It can either be elevated blood pressure with other conditions, with other symptoms like proteins in urine. But if you get a mother who is 20 weeks pregnant and does not have urine in proteins, that does not mean they don't have preeclampsia. And so as we mark this day, it is a call for each and every one of us to come out and talk to the people we see around. First of all, we need to go to the community and sensitize the pregnant women. When they should come to the clinic early. For instance, in the place where we are at Jaramogi, many of the mothers who come to the clinic at around 20-something weeks, about 26, 28 weeks. But we want to predict before even the preeclampsia sets in.
So my name is Joy Ogingo. I work for Health and Economic Development Strategy Organization, EDSO, which is a community-based organization working in Moroni, Seme, and Nyamira counties. We work with adolescent girls, young women, and the youth around issues to do with health, economic empowerment, and environmental conservation. So today we are here at JTRH. We are commemorating the World Pre-Eclampsia Day, and I think this is a very important part of our community awareness campaigns and advocacy, because we deal with teenagers And one of the predisposing factors to preeclampsia is extreme of ages. People with below 20 years and above 40 years. And for us, we deal with people below 20 years around awareness creation on their reproductive health. So it's important to include pre-eclampsia because we have a lot of myths and misconceptions about pressure generally in the village. Yeah, so people still think that if you start your pressure medications when you're pregnant, you'll have to take them your entire life and all that. So we are looking forward to work with pre-eclampsia champions as we have been, and creating awareness on responsive maternal care and the importance of attending antenatal clinics, which encompasses monitoring of blood pressures and organizations.
My name is Lucy Odur. I'm a mother of 3, and I had preeclampsia in my last pregnancy. Previously, I did not have high blood pressure, but when I had my last pregnancy, I started developing some complications. I did not know that it was preeclampsia because I had not had any problem with my blood pressure. So when I visited the hospital on a normal routine, I was diagnosed with the preeclampsia, and I started taking my medication. And after a short time, after around 1 week, I was admitted at the hospital since my high blood pressure was increasing day by day. I was admitted at the hospital at 35 weeks. The ultrasound showed that I was 35 weeks and 1 day. And on admission, I stayed in the hospital for around 4 days. And later I was inducted and I gave birth to a baby girl. I went on with taking my drugs, my high blood pressure drugs, and after some time, after around 4 weeks, my blood pressure returned to normal. And now I'm free of high blood pressure. For the mothers who are expectant, it is important that they visit their facilities early enough so that in cases of preeclampsia, it may be detected early so that they may be helped. Because from the experience that I've had, it is a very, very dangerous situation that may cause death.
Okay, I'm Imelda Bebe, mother of 2. I was diagnosed on 2021 when I was having my second born. At first, on the date of the first month, my blood pressure was very high. I went to Mashambani and I was preferred to go to Moroni, later to, and then when I went to Moroni, they brought me to Russia, where I was helped. I was having high blood pressure, being 180 every time, 180, and it could not go down. So that one, it went that way until I was 5 months of pregnancy, when I was just about to miscarry. So when I came here, at the same time, I was diagnosed with the fibroid, and it forced me to go through operation where the fibroid was removed at the 5th month, and later my baby has to survive. Later, after 1 month, the high blood pressure also came very high, and the baby could not survive, and it forced the doctors to operate me at the 7th month, and the baby survived. So I am very happy, and to be very honest, I didn't want to talk about pressure when I had blood pressure. I didn't want even people to know about it. I gained courage, I could talk to people, and that's why I got help.
You are watching Media One International, always fast and fast. Like, share, and subscribe.